Hey everyone, Dr. James Stirrett here. Today we're going to be looking at the 6 vitamin markers that you can check in your labs to actually accelerate weight loss, balance your hormones, and really get the ball rolling faster. Let's check it out. So why just 6? Obviously there's a ton of different things that we could be checking, tons of different vitamins and markers that we can be checking out there. Why just 6 today? These are 6 that I highlight because I can check these typically within insurance-based labs and get patients a lot of clinical insight into what type of supplements they can be taking to help accelerate their weight loss and get them to their weight loss goal faster. Before we discuss the 6 supplements, I want to really explain to you why this is important to check it all. Like why actually do it? Why go through the trouble? The easy answer is weight loss is not black and white. You have hormone levels, you have insulin resistance, you have exercise levels, you have diet, you have lifestyle. All these factors go into whether you're gaining weight, maintaining, or losing weight. And so one large slice is as far as vitamins are concerned, things that actually make a difference in your body, do you have enough of them or not? When we're able to correctly identify what is high and what is low, then you can go ahead and supplement with the diet or actually with supplements and fill in those gaps. Keep in mind, while I am a doctor, I'm not your doctor, so these supplement recommendations are just strictly informational use. Please get this stuff tested through your doctor, get it checked out, and please be managed by a doctor when it comes to this stuff. Don't go renegade and start taking a bunch of stuff just because we talk about it on this platform. Thanks, guys. So the very first marker I like to look at is vitamin B12. And you can often order this with folate if you're doing this through Quest Diagnostics or through LabCorp. And insurance likes to cover this one because B12 can really impact a lot of different systems in the body, which is why we're talking about it today. It can impact metabolism, it can impact your energy levels, it can impact a lot of different systems around the body. This is why you hear about people taking B12 supplements, it's in multivitamins, or getting B12 shots. I've even worked in a weight loss clinic before where we gave each and every patient B12 where it was indicated because it helped accelerate the weight loss journey. I don't think that was actually necessary, but it is necessary to check it out because if you're deficient, this is something that will decrease your metabolic rate and can be holding you back. The lab will use PG per milliliter. Forget about that. That's just the metric that they use to measure it. What I'm looking for is something over 350. Anything 350 and under is very, very low. You are extremely deficient in B12. Now, if you're 350 to 500, I still supplement at this range because I see that as a functional deficiency. Above 500, sometimes I still will supplement, but it's not as big of a deal. As to form, I prefer the methylated version of B12 as this is easier to absorb and for your body to actually use. Number 2, now this is very similar to B12, slightly different take on it. It's called a homocysteine. Homocysteine is cool because it's a marker that we can look for overarching B complex levels. If homocysteine goes high, it means that you are low in B complex and you need to take a supplement that contains some B complex vitamins. Now here, when your levels come back, we're looking for something under a 10, ideally under an 8. If it goes north of that, let's say it's 11, 12, 13, then you're really deficient in B complex, and that needs to be something that's addressed in order to meet your weight loss goals. This is going to take account into, again, metabolism, but then it's starting to cross into a lot of other metabolic things that are happening in your body when it comes to detoxification, energy, and even your cardiovascular health. We actually look at homocysteine as a marker for cardiovascular inflammation when it starts to get higher. When that, like, let's say we see a number of 15, 16, 17 or more, then we're really going to be starting to worry about your cardiovascular system. And that also, if you do see that come back on your labs, don't freak out. Just make sure to discuss it with your physician. But it also is a higher likelihood that you're somebody that suffers from MTHFR mutation. And that might just mean that you need to be on a supplement like a B complex long term. Next up, number 3 is magnesium. Super easy. It's a red blood cell or RBC magnesium. And I believe the range is anywhere from like a 2.5 to a 6 to identify deficiency. We really want to see that above a 4, ideally closer to 6. So magnesium is responsible for a lot of things in the body, but when your magnesium levels are adequate, it means that your inflammation levels are going to be lower. It also implies a higher level of gut health, which we know impacts absorption, inflammation, autoimmune disease, and cortisol spikes up and down regulating blood sugar, just so much there. So you got to take magnesium. It also has some other health benefits associated. It can help with sleep, can help with brain health, can help with heart health, and ultimately can help you go to the bathroom. So I do prefer to use magnesium citrate typically for this. Anywhere from 200 to 400 milligrams a day is a normal dosage for magnesium. But you'll know when you're hitting your own personal upper limit because it will start to make you go to the bathroom more. Quick update for you guys. If you're liking this, go ahead and grab our free hormone balance cheat sheet. It's really helpful for hormones and losing weight. And there's a ton of free value in there. It's a PDF download. You can print it out, stick it on your fridge. And there's a bunch of stuff to live by so you can hit your goals faster. So grab one of those if you're interested. All right, fourth vitamin to check. And this is a big one. It's vitamin D. So many of you guys probably have asked your doctor to check vitamin D. A lot of people just assume that they're deficient, and you're definitely right on that. Depending on where you live, longitude and latitude, you're going to be deficient in vitamin D most likely. For instance, I live up here in the Pacific Northwest. Almost all of us here in the Seattle area and Washington area, just because of where we live, year long, even in summer, are deficient in vitamin D, even if you're outside every single day, like my family tries to be outside enjoying the summers. We're all still deficient in vitamin D. I take vitamin D. My kids take vitamin D. But here's the ringer. Vitamin D has been shown to assist with weight loss in most of the studies that I have seen, especially with women, middle age. Vitamin D becomes really important with immune health, hormone health, getting things balanced out. And ultimately, I've seen studies where the only intervention, the only thing they changed was putting women on vitamin D, higher doses of vitamin D, and weight loss was actually seen. So that just shows how important it is, and I do encourage you to get these levels checked and get things managed. Now, if you look at the levels of vitamin D, you'll see that labs will vary a little bit for what's truly deficient, what gets flagged. Typically, it's anything under like 24 or 20. Usually here in the Pacific Northwest, when patients come to see me, people's levels are anywhere between like 15 to 30. Regardless, I always put people on vitamin D. So we want to see levels anywhere from 45 to 80 typically. So for weight loss, we really want to land somewhere in the middle to be balanced out. Number 5 is iron. I love checking iron, especially in women. I always do a full iron panel, and the most important component of this is adding a ferritin. Ferritin just resembles your iron storage. For a woman that's still cycling, we really want to see this around a 90. I consistently see women less than this. And it's usually a combination between 1, cycles are too heavy, or 2, you have weak digestion, poor absorption, and the iron might not be getting into the system, and it's certainly not getting stored. And we can read that in the ferritin, which is why it's one of my favorite tests. So when we see the ferritin low, my favorite thing to do is 1, you got to treat the gut. We got to make sure that your digestive integrity is awesome. Tweak the diet, get the right probiotics, tailor a digestive repair protocol that's right for the individual. But then on top of that, we will often do oral iron. The type of iron that I like to use, it's kind of a mouthful. It's called ferrous bisglycinate chelate. I like to use anywhere between 30 to 90 milligrams per day and try to find a product that is not going to cause constipation. There are better products out there. I urge you not to just go to Bartell or Walgreens or Safeway or whatever drugstore is around and just buy yourself the iron off the shelf. Usually it's going to be really poor quality, poorly absorbed, and it will lead to constipation. So you want to find yourself a quality product. All right, so number 6. This is a little bit of a bonus for you guys. So it's called the omega check. And really what it's doing is it's looking at the ratio between omega-3 fatty acids and omega-6 fatty acids in the bloodstream. Omega-3 being an antioxidant, anti-inflammatory, and omega-6 fatty acids being a little bit more associated with the possibility to promote inflammatory pathways. Obviously, in weight loss, we want antioxidants, we want the opposite of inflammation, we want no inflammation, we want water weight to leave the system, and the only way to really do that is to promote pathways in the body that are anti-inflammatory. When you get these test results back, what's going to happen is it's going to give you a ratio between omega-3 and omega-6 fatty acids. Is it's going to say, is it enough omega-3 to be promoting regularly those anti-inflammatory pathways? Let's say you get the test back and it says, no, you have too much omega-6 relative to omega-3. What you want to be doing is increasing those omega-3 fatty acids in your diet, eating more fish, taking fish oil supplements. I personally like to prescribe a lot of EPA, DHA supplements at 1 gram each per day. Remember, that is not a prescription or a recommendation for you. personally, that is just what I recommend to most of my clients to bump those levels up. We typically check again in 2 to 3 months so that we can ensure that we're on the right track nutritionally and that all of these vitamins and nutrients are exactly where we want to see them so that people can be hitting their weight loss goal at a more efficient rate. All right, there you have you guys. Those are the 6 vitamins that you can check in blood work. Now here comes the more challenging part, right? Asking for these things to be checked from your doctor. As a doctor myself, I really appreciate it when patients come to me and they ask for specifics. Get a little notepad, write down the things that we talked about, and actually take it to your doctor and say, hey, here's 6 things that I would like checked on my next blood panel. They're going to either tell you yes or they're going to tell you no. If they tell you no, then hey, find a doctor like myself and we'll run the whole gambit and we'll make a custom plan for you. And that's awesome. But your doctor might be able to check a few of these things and get you in the right direction first. If you enjoyed this video, go ahead and hit that like button for me and go ahead and hit the subscribe as well. And there's a little alert bell right there. If you click that one, it will let you know when I release videos weekly for you. Go ahead and throw a comment in because it really helps. I like to hear people's opinions. If you loved it, hate it, let us know. Thanks guys. Till next time. Bye.